Okay, I guess we'll call our meeting to order. No public comments, I presume. Robin, do we need to go in this particular order? I don't know if I reviewed the board policy.
Let me make sure everybody has a packet though. You got yours.
I've got it. Yeah, I'm good.
This one.
Does anyone else need one?
They need.
Yes. Thank you.
Thank you.
Robin, I read through these. Obviously, a lot of these are governed by the education code, the election code. So there's not much of, in terms of us adding or subtracting to that, because it just comes right out of the statute. I didn't, in going and reading this, I didn't see anything in there that jumped out at me and said, well, we need to address that.
No, y'all, or Manuel, you had wanted to each time chip off the
Right,
big
right.
series. And so we didn't necessarily put them in here for amendments or changes, but for you all to, especially since elections are coming up, we thought this might be a good time to learn about it.
Right. I didn't see anything in there, I mean, just as a blanket summary, I didn't see anything in there that jumped out at me and said, well, this is something that we need to discuss further in our regular board meeting.
Right.
I'm assuming that these policies are reviewed by council. I don't think there's been any changes.
Oh, no.
And looking at the changes that we had before in our other meetings, I didn't see anything in there that affected these things.
No.
And just, when I went through the process, and of course Rosie, you and Chris went through the process, I didn't see anything in there that was not done whenever I did it, that, i.e. the election process.
Yeah. The other real question I had looking at this was the trustee boundaries, right? Because I know at some point we're gonna have to do that again.
And that's gonna come after your census.
Right.
Yeah.
Right.
So census will roll this spring. You're supposed to get numbers, I think, by next December,
Right.
if memory serves me correctly.
Yeah.
And then after that, you may need to redraw your district boundaries, because in here it specifically says you're supposed to have some equitability as far as the numbers of people, and they
Right.
should be concise in everything within one area. They shouldn't be dappled all over the place.
Right.
We had to redo our boundaries at the last census. Remember, like area 2 and area 3, those boundaries changed at the last census.
Okay.
And in your local policy, you know, you've got your, I don't think it gives the numbers, but you've got your 5 that are, single-member voting districts, and you have your 2 at large. And
Right.
single-member voting districts, I mean, they represent a very specific area of town.
Right.
At large is the whole community. Generally, single-member voting districts are there because you have a diverse community, and you wanna make sure that the entire diversity is represented on your school.
And then there's a connection towards the number of people we have in our area. I think if is it 10,000 perhaps, that you can have just 5 board members?
That's correct.
Okay.
You're absolutely right.
So I think the only thing for purposes of our board meeting in a couple of weeks is that we'll just mention that we may have to take a better look at this once the census comes through. Other than that,
Yeah.
I mean, I think everything else is in line.
And generally, there are attorneys that's, and since you've had in-house counsel here, I'm not sure how it works here, but there are people that specialize in just that. And they'll usually come and advise you on what your districts need to be, and, you know, you can choose to do it or not.
Right, okay. all
We
right.
had outside counsel last time, and they came and we had community group.
And you have already
And do all
contracted with
that.
that person, because back in October, I think it was, I brought that, it was on your consent agenda to go ahead and approve them for this next
Yep.
time, because he was thinking of retiring, wanted to keep a few clients.
Yep.
We may mention that also at the next meeting.
So
That-
Julie, I can get us
That's
that.
coming in the future.
It's really kind of a
Just start
fascinating
remembering
process,
things.
it really
Yes.
made you think about things.
Right, right.
And with the new superintendent coming in too, you know, you want him to know
Right.
that you already have some counsel in place, that's who you used 10 years ago, you're gonna use that person again, and go from there.
Okay, all right. And I think, Rosie, Chris, I don't know what you guys think, but I think we ought to just review these, just to at least look at them. In every meeting, we need to look at a piece of this. Obviously, it's very, very large, but looking at it piece by piece, I think is a good idea.
One bite at a time.
I agree.
Okay.
Neil, you may want to, say just a little bit to the board, like a brief summary about electioneering and political advertising. And if that comes up within the district, especially political advertising, not necessarily electioneering. And Mike will be your election judge, so, or that's not your official title, but he's your election person. But, the political advertising has some very, very specific pieces in legal on page 9, so
Yes.
that may be worth a discussion.
Okay. The definition comes right out of the election code. Well, and Ty and Janet are in the process right now.
Correct.
So I'll mention those, I'll summarize those 2 points.
And what's interesting is political advertising doesn't mean you're just, not just that you're supporting a candidate, but if you're against a candidate, either way, you can't state one way or the other.
Right. Anything else, Robin, other than those 2 points? I'm making a point to mention census.
It's not in here, but for your information, people's names are a matter of public record. And I know we had this when I was in Temple, and we had someone that was running for office that requested those names, and those have to be provided, but you don't provide other information. And actually, they can even request the email addresses. And if it's from an outside source and they send it in, there's not a whole lot you can do about it. And that was a surprise to me.
In what context, what do you mean?
This person was running for office and wanted to send out something, vote for, whatever else, and he was able to acquire the names of people. And I don't remember about the email, but I think it was the email because it came out and I was like, oh my.
The names of people from
Employees.
employees from the district.
For their personal emails, not district. Can't use the district piece, but for the outside.
Ah,
Yeah. And
That's
like I said, we
interesting.
were kind of surprised.
why, is that because they're government employees?
Subject to Public Information Act. And that's not protected.
Interesting, okay. All right, anything else on the, as far as that packet's concerned? All right, then we'll move on to the next item, which is our only other item. Coach, I guess you can take it from here.
Sure.
Are you and Pete gonna kind of work together?
We're
on
gonna
this?
I'm gonna kind of outline it, and I did ask Pete to come today. Pete is our coordinator of emergency preparedness, and a lot of the things we're gonna talk about today, he has been instrumental in not only the design, but also in the implementation. And so I thought it would be appropriate for he to be here and kind of piggyback on some of the things I'm gonna provide, and be able to obviously answer questions and discussion as we go through. I did not put any policy in the packet because we're not really talking official, our policy today. We're talking kind of 3 main areas of conversation. I want to kind of take you through some of the highlights of the Senate Bill 11 and how that involves in our emergency operations plan. And then I want to take you through some threat assessment and kind of brief you on where we are as a district. And then kind of throughout that, kind of talk about the challenges that we're seeing and other districts are seeing in implementing these huge pieces of legislation that were passed. And also kind of what we envision this thing going as we move forward and conclude this year and move into 2021. And so I kind of broke it down. I don't want to go through both of these packets. I really wanted to give you all these packets so that you're seeing some of the same things we're seeing. The first packet is it's an excerpt from the Texas School Safety Center, basically on the most updated information they have on emergency operations planning, and it's kind of specifically towards legal requirements and guidelines, and I'm going to hit some of the high points of this packet. And I also included some information about the 5 phases of emergency management, and we'll talk briefly about those, but it's really just to make sure everyone is kind of on the same page, and as we plan and prepare and as we put our EOPs together, kind of what the FEMA model and the one that's been adopted by School Safety Center says. I also gave you the TASB update on Senate Bill 11, and it's gonna be much more comprehensive than the information I'm gonna include today, but it is something you can kind of see what we're getting and what we're seeing. The great thing about a big piece of legislation or big legislative cycles like we just had is you don't always get quick information on interpretation or implementation or rules for the legislation. So there's really three entities that we're kind of waiting on some guidance on parts of this. Parts of the legislation are simple, straightforward. We were able to implement immediately when we got the final versions. Some are a little more challenging, and we're kind of waiting on some more guidance from TEA, from the Texas School Safety Center, and from the Texas Governor's Office. And kind of from what we understand, and Pete can help me on this, is that the School Safety Center is supposed, their update, especially on EOP planning and threat assessment, is supposed to be coming very shortly, from what I understand. It's February-ish, is kind of what their timeline was. Mm-hmm. There's gonna be some TEA guidance coming later this spring, and then at the Midwinter TASA conference last week, the School Safety Center said that the Governor's Office guidance, or rules, if you wanna call that, should be out by June. So what they're expecting is full implementation of the legislation by August 2020, and then that's kind of what we're working towards, although a lot of it we've been able to implement already. And so, let's start with emergency operation planning, and I'm gonna go fairly slow. I'm not gonna read the packets to you, I'm gonna hit the highlights, but I'm gonna really kind of try to put it in the context of where we are and what we've been able to do so far. And also, this will probably allow me, whenever we do our safety update, some of this will be covered in the policy report, and it will allow me to focus on some other aspects of our safety update that we're gonna get this month as well. But, so we've had emergency operations plans in place for a long time, I mean, as all districts have. And so kind of this process started as we took our existing EOPs and we sat down this summer and went through the Senate Bill 11 items that we knew we would have to add first and foremost. And I'll go through those a little more in depth. This Senate Bill 11 was the most notable piece of legislation in the 86th legislative session. And like I say, we've been waiting on some more interpretation and rules. We're in the process, though, of making sure that everything we can interpret and implement now we're doing. The other things we're planning for, a lot of it involves training components, and it involves affiliations and coordination with other law enforcement and other government agencies as well. And I'll kind of talk about that a little bit as we go through. One of the biggest things is it did require that all public schools, which have always been required in most recent history to have EOPs, but it also for the first time required charter schools and public junior colleges to adopt and implement multi-hazard operational plans as well. And then every EOP has to include the 5 phases of emergency planning, which is prevention, mitigation, preparedness, response, and recovery. And so these principles are included in the packet, and they're straight from the Texas School Safety Center resources. So here are the highlights from the Senate Bill 11 and kind of where we are with most of these. It ramped up the training that all employees have to have. We've always had first aid training and CPR training and all those sorts of things. But now it's very specific about the training you have to have, and it also goes to include all district employees and substitute teachers for the first time. So that is something we really think is a great practice. But so it's not limited to, but these trainings include our CRAES, which is our active shooter training, our Stop the Bleed training, which is the critical response, our standard response protocol, which is the different operations that we use to handle different emergency situations that come up. Some of the CPR refresher is the one that most of our employees are required to have, not the full course, and just some basic first aid as well. Are there any other trainings that we're hitting with all of our employees and substitutes?
Did
Right
you
now.
say Stop the Bleed?
Stop the Bleed, yes.
Stop the Bleed training is probably the big one, and then the inclusion, like you said, of the substitute teachers and anyone that would be employed on a campus. It might be more than likely in contact with students.
Mm.
So that training includes individuals that we kind of knew they were there, but we never really included in the overall planning and training of it.
Somebody else, maybe a stupid question, right? So substitute teachers, I would assume that they could potentially come and go during the year, right? I mean,
They
they're-
do.
Yeah, right. So do we basically have to have a continual?
We do. We did
Yeah.
a training at the beginning of the year for everyone that was on roster. We did another training in January 7th for everyone that was on roster,
Okay.
and then we will fill in. We're still kind of working through that process.
Yeah.
Some of it's available online. So
Okay.
one thing that we, in anticipation of this, some of it has to be hands-on. The first day, the CPR refresher has to be hands-on. The stop the bleed, where you actually work with the modalities and you practice putting on the tourniquet, you practice stuffing the wound. Those have to be done hands-on. But the craze and the SRP and some of those can be done online.
Okay.
So we actually recorded all of those trainings in August and through Frank Hernandez in our HR department. Those are available online where they can complete that training as part of the application and approval process. So we're kind of doing a combination. Some of it is in person, some of it's online, but we just have to make sure that we have all of our employees and substitutes trained in these areas.
No, I think it's great.
So I thought it was a great guideline, because I think that's something that probably a lot of districts wouldn't do if it wasn't required. And probably a lot of substitutes might not want to go through all that extra training if it wasn't required as well.
What's the deadline?
It's ongoing.
It's ongoing.
Since you have employees that come and go throughout the year, and you have substitutes that come and go throughout the year, so it's just basically school safety and HR working together just to make sure that the employees have that training.
But
Go ahead,
I
Ron.
think your question was, when do we have to have the ELP and all that done? That's that August of 2020. correct?
Yes,
Okay.
yeah.
Yeah, when you say all of district employees, is that literally all of them?
We train all of our paraprofessionals are trained in these, all of our
Who is
security.
not trained? Let me ask it that way.
Depends on the training.
Yeah,
But for the emergency response training, the craze and the stop the bleed, all the employees are supposed to receive that. Like Mike said, we're still trying to work through the logistics of it. But the thought process is, for example, your groundskeeper, who may be out on a school campus, encounters an emergency, whether it's on, fellow worker or student. So the thought process is that they all are trained to be able to respond.
So it's literally everybody.
mhm.
Wow.
So, and that's the challenge.
Bus drivers?
I'm sorry?
Bus drivers?
The bus drivers also receive that training, but they have specialized training in regard to what they do, in regard to their department.
And the challenge is in non-contract employees that come and go a little bit more. That's the change. Contract employees that are, you can pretty much know they're gonna be here at the start of the year and the end of the year unless something extraordinary happens. It's your non-contract people that kind of come and go a little bit more, that we have to be creative and we'll use our in-service days when students aren't here, and grab groups and train groups at various points in the year, so.
A new teacher, for example, has to do all the training before they hit the classroom, or is there a?
It would just
phase-in?
depend on how if a new teacher that was hired at the beginning of the year, yes, they would have all this training in August before school started. If it was someone that, if you lost an employee mid-semester and a new person was hired, we would get it as soon as, first available date to get that person trained.
Like I came in the very end of August, and they gave me, I want to say 6 weeks. There was a deadline on it.
And it also, this is one part, not to be confused with all of the other online trainings that are required by state law. These were just the ones specific to safety and security and required by Senate Bill 11. The others, all of the different ones offered by HR, all the safe schools training, that's in addition to this training as well.
Now, this is not one the board members have to get trained in, correct?
No.
Okay, because you will have to get training, in cybersecurity, if I recall,
Right,
and
that was a
in
new.
Trafficking.
human trafficking, and I
Mhm.
think there was a third one.
Sexual abuse.
That was the human, oh, it was sex abuse, it was
Yeah.
separate from human
So those
trafficking.
Mhm.
So if a substitute comes on they can, as long as they're on schedule for training, they can set, because that would be really hard to.
Yeah, it
make
would be.
sure. Okay.
And they're still gonna be briefed. Now, the one about the standard response protocol and emergency procedures, they'll be briefed at their campus about those particular, where to go, here's where you're gonna be today, here's where you go if the fire alarm goes off, here's where you go if we have a lockdown, those sorts of things. The ones that are a little more skill specific, we catch them when we can, because, we won't be able to, especially the ones that have to be done in person, hands-on, which is really the stop the bleed and the CPR.
Mike,
Refresher.
I don't know if maybe you or Pete can answer this question, but which part of Senate Bill 11 was the most important to you?
Well, they're all pretty much tied together to the emergency, but what I saw is, and coming from law enforcement, is the actual movement of, dealing with an emergency from a responder perspective, as opposed to, I think traditionally you'd know how you're supposed to go run and hide, and, maybe we didn't have basic skills in, how to stop a bleed, especially a serious bleed. So those components, along with mental health, we think is a very big component or important piece of what we're having to do. Just because, historically we treat the symptom, or not the symptom so much, but what we see, we just kind of say this is the way we're going to deal with it. And now we're actually looking at causative factors and how we as a school district can intervene with some of those emergencies.
To me, it was the threat assessment component of it too. I mean, to actually have a process by how you hear about something that may or may not be a threat, and now you have a process to go through as an intervention to try to get that student the support they need, and also make sure the rest of your students and staff are safe. And I'm going to talk about threat assessment kind of in a little more detail, but to me, that was the most, coming from the world I came from to this world, that's I think the most important piece of all this is the ability of a district to have a plan to intervene and keep things from happening before they happen.
I think
I'm sorry, go ahead.
I think the sharing of information from police departments to school districts was
Mhm.
huge in this one, because that has not occurred before, and that wasn't in 11, that was in.
Senate Bill 2135.
But, basically, if we do a threat assessment and determine it to be a threat, the police departments have to give us information, and that never occurred before.
Or safety plans too. So if we're putting it may not even be a threat situation, it may be we're putting in a safety plan for a student, and we can request information now too.
Now, the flip side of that is not all true. School districts are not required by law to provide information to law enforcement because of FERPA. And so those have not caught up with each other yet. I don't know if they will, but it has led to some interesting discussions with our law enforcement.
So are these trainings yearly, or how long is the certification good?
Yearly,
You do-
they're
it's
annual.
yearly.
We do an annual training on
Okay,
all of
okay.
this. This will be our third year for Stop the Bleed and Craze coming up. So our employees will have had three hours of training in each one of those areas by next fall.
Who keeps up with all that? Who's in your office?
Well, that's one of the things. A lot of it's kept up with through HR, or most of it's kept up through HR, but some of it falls on our health services too. When you get into some of the CPR and first aid and some of those things, that's kind of through the health services department. And that's one of the things we're kind of talking just in our department meetings right now, is how we can get all this in one spot where you're not having to go to 2 or 3 places to figure out what training people have had. So the majority of it's kept up by our HR department. And so communication devices. So this is one that I think we're in a really good position on this. It says that all employees and substitutes must have access to communication devices to communicate in the event of an emergency. So those could include classroom phones, which we have phones in basically every classroom in the district. We did another assessment in the fall to see if there were any areas where we don't. Two-way intercom systems would suffice this as well, and then cell phones suffice this as well. So if we had an employee come in or a substitute come in, and if they were in a room that didn't have a phone, didn't have an intercom, and they didn't have a cell phone, then we would be required to make sure they had some way to communicate in the event of an emergency. But fortunately, I could say that we don't have any of those situations. That we do have areas that we have some repairs that need to be made, and we're looking at all of it. But communication is a big part of it. Every employee has to have access to communication in the event of an emergency.
And that grant that we told y'all about, or in News of the Week, 2 or 3 weeks ago, that has some more radios in it for communication.
Yep. So measures to ensure district communication during an emergency, and that ties directly to the two-way radios. We're going to, in the process of purchasing, through our TEA safety grant, two-way radio system that will work district-wide. And in the event that if the network went down, the phone system went down, cell towers weren't working, we'll have an independent two-way radio system that could connect all 19 campuses. Transportation, support services, and administration could all get on the line and communicate with each other. And we think not only is that a best practice for dealing with any type of community-wide emergency or multi-campus emergency, but it's also make sure that we're in compliance with Senate Bill 11 requirements as well. So that was and I'll go into a little more detail at the safety update, but of the items that we were able to address with the grant, that's what we felt like was the most important. It's the most significant portion of the grant, but it's also one that allows us, regardless of what's happening with Wi-Fi, internet, or cell towers, we can still communicate with each other.
And that's being implemented?
We have it bid out, we've submitted the grant, all we're waiting on is the approval of vendors and then the money, the check to come from TEA, and whenever it does, we'll be ready to roll. Provisions to include immediate notification to parents in circumstances involving a significant threat to the health or safety of students. That's something that I think Belton ISD has been doing a pretty good job of that for years, but it's mandated now. So we basically, when an issue occurs, an emergency or a threat assessment or any of these things occur, then usually in conjunction with law enforcement, we look at, is it real? Is there a real concern? And if it is, then we're gonna let the parents know. And that's usually gonna be done by Skylert, and it's also gonna be done with coordinated efforts to get word out to the media and things like that. But we're gonna make sure that parent notification is very important to us. And even if we find no credible threat, with social media and the way things go now, we need to make sure we let parents know what's going on to the best ability that we can. And within the law and within what the privacy laws say we can and can't say, and what law enforcement says we can and can't say, sometimes we're bound by that. But we will notify parents and immediately or as soon as possible, I think is exactly how the legislation says, on threats or emergency situations.
If we get any feedback, if they want more information, and we had that on the most recent one, and we just can't. The one thing that one parent said, she said, well, people don't know what FERPA is. And that's a valid comment, but we had already sent out the Skylert, no one's gonna come back and send another one because it alarms people. So I just responded to her, if I have other parents that comment on that, then I will send out a second, but we didn't.
And it's particularly like when rumors take legs and go, and you hate to heighten everyone's sense of panic already, and then you don't want them to zero in on certain kids that may not even be involved, but so that's kind of where all that lies. But if a credible threat or something that we're investigating, we're obligated, and we will let parents know as much as we can, and especially if it's a situation where we have to change plans, then we're going to be in constant communication with them on that. Coordination with appropriate response agencies. So that would be for us, all of our first responders, and we kind of meet that means with our district safety committee. We have representatives from law enforcement, county emergency responses, county and city fire departments, sheriff's office. I mean, all of those guys are kind of involved in that process. We also have very, very coordinated and meet often with our SROs, who is our first line of first responders. They're the ones on our campuses. They know our kids. They know what's going on. And then with we've kind of created a group with the local police departments too. We've been meeting about every 6 weeks to kind of talk through issues like information sharing and emergency planning and response and things of those natures. So we feel like we're in a pretty good place of coordination with appropriate response agencies in the event of an emergency.
On the mental health support, mental health agencies, that's one that Mike and I visited on today. That's the one that we feel like we can improve upon. We've got a great lady now, Tiffany Summerfield, and she is working so well with Mike and Stacy on that. So whenever there is a threat assessment or something else, we are, from the get-go, bringing in a mental health component. And that's pretty new. That's really new.
And it's the biggest challenge too, as going to conferences and talking with other districts. You know, when it talks about, then there's some pretty detailed, some of the mental health components are kind of summarized in this TASB update. But for us, the kind of the challenge is balancing what our district resources are, which are really good in some areas and really limited in some areas when it comes to mental health, just because of the way school districts are set up by nature. And then also balancing that with ESC Region 12, who has counselors and mental health resources. So when we have an instance where that type of support is needed, we reach out to them and say, hey, we had this tragedy happened. Here's what we're thinking. What else do we need to think about? What else supports do we need to have in place?
You know, Mike, one of the resources listed was communities and schools, and I don't know, we have a meeting with them on Friday. Now, I don't know if we probably need to make more concrete communities and schools' role in the event of these emergencies, because for these threats, I don't think that we have really used them in that capacity before.
No. And we've had some preliminary discussions with them on that, but we haven't gotten down to
We'll
the.
bring it up when we visit with them on Friday.
And then I passed out, there's one of the components of this is that every school district in Texas had to be provided at least some resource from the ESC Service Center. So this is kind of what we've gotten is that, if a school district has a situation come up and they don't have the resources, ESC 12 maybe, or in our case ESC 12, but their Education Service Center may not be able to help, that they could reach out to. For us, it's the Central Texas Center for MHMR Services as well. And
So have you reached out to the Texas Psychological Association, who has the connection like with Red Cross, that has the list of providers that will come in at any time? Okay.
Texas Psychological Association.
I can give you the contact information.
Okay, yeah, please.
I'm happy to do that.
I'll work with Tiffany,
But
we'll
that's a
reach out
big
to
thing
them.
in conferences, that they're really encouraging people to train and be connected with the Red Cross. So in this situation, you're getting the people who are already trauma trained to come in.
Mhm. And there's some component to that. Pete goes to the Central Texas or the Bell County meetings of emergency preparedness and things, and there's some resources there too.
But
Yeah, so that's another resource that we would use. We're also implementing,
Hold on a second. Do they have a comprehensive list of all the mental health providers? And I'm not talking about individual people, but agencies in this area? through the
Right.
phone?
I'm
That
not
was a
sure.
problem years ago.
CITCOG may not, the Children's Special Needs Network does have a list of all the providers
Oh,
in
it
the area.
does?
Mhm.
That's good to know.
And you
They
bring it up,
coordinate with each other, so I don't know, I'm sorry.
you bringing up these resources, this is actually in our district safety committee meetings. We have the community partners coming in, and just this last meeting where we talked about human trafficking, sex trafficking, that kind of keeps some of the other attendees to say, hey, look, we have grants, we have resources, and we have some other things that you can reach out to. And we feel that that's probably what's happening across the state, is that we're trying to figure out what we have, what we can use, and under what circumstances. And I think I see that kind of coming together.
and what I put in my notes too is this is what we've identified this in discussions, it's the most significant challenge. The challenge is identifying what the resources are, and then defining who, how, and when to intervene. That's the challenge, there's all these resources out there, and it's getting those relationships established and knowing who to call depending on what the situation that's going on is. And that's kind of what we're working through. And like I say, that's that anything that we can reach out to, because we don't just have to go through who at ESC 12 or whoever says, we can establish our own relationships. And I know some districts are even contracting,
I just know
those
those
types
community
of
services
services, so.
lists in the past, because I served on so many of those boards and committees and things. It's really hard to find them. They're just all over the place. And so to have one list someplace, we'll contact them and see if they have that. But as of 2 years ago, no one had one. Everybody had different ones.
And a lot of it right now goes through, we contact one of the experts or one of the representatives over at ESC 12, and they say, we can help with that, or they refer us to someone else. That happens a lot.
Is there still a CRCG?
Mhm.
Is it active?
Ann Lake can answer that question, I can find out, I can talk to Ann.
It'd be real interesting, because they were the ones that put that directory together before, such as it was.
There are some specific planning needs that are addressed in Senate Bill 11 that a lot of people probably had in their EOPs, but some may not. Like if your campus is within a 1,000 feet of a railroad track, you have to have a plan for a train derailment or some type of situation like that. If you have portable buildings, you have to make sure that plans for portables are addressed in all your different emergency situations, which I think is vital. That, you know, because it's different, you know, if it's a weather incident or a shelter hold or a hold or a lockdown or a lockout, I mean, your response in a portable is gonna be completely different than it's gonna be if you're on an interior building, interior room in a building. Also, it requires EOP to have specific emergency planning for polling locations. So I think about, you know, we have early voting going on, opening up soon, you know, in the next month or so. And you have to make sure that you've addressed emergency planning for your polling locations, whether it be early voting or, and then also, this just goes along with something that, but equal access for students and employees with disabilities in emergency planning. You know, we all have meet the ADA requirements for just daily business as usual stuff, but you have to make sure that your emergency planning, you know, if you have evacuation routes and things like that, you have to make sure you take into account that for employees or students with special needs and disabilities can follow those plans as well. So
Do they have cybersecurity in there?
there's cybersecurity, other than the cybersecurity training, I think that it mandated for all employees.
Assisted with
to do,
Angela this
so.
afternoon, kind of briefing her on our meeting on Friday, and she said that needs to be in that EOP, and it really, really, really does, Pete.
Does the bill call for extra training, or has Belton considered extra training for our kids that are under special education? You know, it's very different to have training and have teachers in the classroom know and do the drills
Mhm.
for someone who might be able to reason through that with less difficulty. But it's very different nature when you have a group of kiddos in a special education scenario. Are we offering any extra support or any extra training for those teachers?
I don't know, that's a good.
That's a really good question. The bill that, in my recollection of, and it's, you know, 20-something pages long, but I don't remember reading any requirement for additional training.
Mhm.
But I think that's a very good recommendation, that they may need a little more practice.
I'm
And just,
sorry?
Would you put that on the list, please?
Yeah.
Sped, additional training.
to my knowledge, no, it doesn't require it, and to my knowledge, we probably haven't been doing additional drill training with those populations.
Mike, you talk about all these safety plans, I mean, who's creating those? I mean, does this,
They're owned at the campus level, but safety and security, like for Pete, that's one of his areas of responsibility. So he has worked with each campus and each department on their EOP, on their emergency operations plan.
There's some pieces that are standardized across the
Yeah,
board
right.
that he's put in place, and then how they do those pieces on campuses obviously varies.
So the easy part is that the template is already provided by the Texas School Safety Center. So basically, we take that, and that's their recommendation and best practices, is that you take that template and you individualize that to your environment. So like Mike said, the train, if you're close to railroad tracks. Any things that would be unique to your campus, those are the things that become, again, specific to that campus, but the rest of it is all consistent.
is it the same for all of our elementary schools? The exact same one for all of them?
The exact same one. As far as the preparation, like you said, the 5 things that we need to look at, mitigation, prevention, all those are gonna be basically the same. The response may be different because you're talking about kids of a different course,
Oh,
ability level, comprehend, be able to respond. And so we focus on, when we do our drills, we focus on that age group. We did a fire drill. And we kinda had a perfect storm. I stayed behind to watch how we were clearing out, and we also look at, for example, somebody pulls the fire alarm and really the threat is outside. What does it look like when we're trying to herd all the kids back in these small 2 doors? So we plan for that, other options. During this drill, there were larger kids, 5th graders, out at recess. So the drill is over, they announced that the drill is over. We still have kids trying to get back in to the building. The older kids are told, hey, go play. So it turns into a big run. Little ones are falling down, they're not getting up. You literally have to go and pick the kids up. So we use that as a kind of a teaching moment to say this may be something that it looks like this, So we try to debrief, well, we don't try, we do. We debrief and have after-action meetings after all our drills to see where we can improve, what worked, what we may need to change. But so it is individualized from elementary up.
And the difficult thing about drilling too is it's, when everyone's in class and no one's at lunch and everybody, and you do your drills, that's one thing. But when half your kids are at lunch or, kids are just getting to school or fixing to dismiss and we have to drill in some of those situations as well. I think we have had some situations at the high school where we've gone into a hold prior to first period starting. So, how does that look and how does that work? And, that's been a pretty, and like I say, we try to have Pete or Doug, and we have some other district staff. We have an alarm specialist that he's the guy that basically works with our fire alarm companies and things and all the testing. We try to have as many of those guys present when we drill. And then like I said, we always follow it back up on the campus level with an after action and a review to make sure that things went as we needed to, or we make the adjustments we need to if it didn't. So.
Have we looked at, I know when we did our standard operating procedures, we looked around and at other districts and see what they were doing. Have we looked at other districts to see what?
To an extent, a lot of people, because of the nature of emergency planning, a lot of people keep those pretty close to the vest. You don't want your procedures and practices out where they might get out in the public. So we do share and we do go to trainings. And we go to trainings that are specific for the types of things that we're gonna have to include. But I would say it's probably more, Pete, from just discussions with other districts than it is saying, hey, I'll give you your plan if you give me mine, and and every trade off and compare notes like a playbook or something like that. It doesn't happen as much.
And you have to submit an audit every 3 years, and we're up next September.
Right.
So
Our
that'll be
audit's coming.
something on y'all's plate next year.
Yeah.
Mm-hmm.
District School Safety Committee, some rules, or it was more clearly defined by Senate Bill 11. I'll say this, I feel like we're far exceeding what the state requirements are on this. So I think you're required to have 3 meetings, we're gonna have 7 this year. A typical meeting for us is we will come in and do a briefing, we'll usually give a couple of quick updates. Hey, here's a project we talked about, here's where we're at, here's a piece of legislation we mentioned, here's kind of where we are in compliance. We generally, one of the components of the School Safety Committee is to have them evaluate and make recommendations to your safety plan and so we've taken several things to them. We try to take at least 1 or 2 ideas to them and say, what do you think? One of the things that kind of came out of one of those discussions this year already is, we have our Stop the Bleed kits on our campuses as mandated. But we took that to the next level. We want to put them on our vehicles as well. So one of the recommendations that came from our safety committee is to look into the cost and the implementation of putting Stop the Bleed kits on all of our school vehicles and buses and white fleet. And that's something that we have actually turned in a quote on that. We'll be getting those in, and we'll put those in this spring where we have. So those are some of the discussion based things that come from that group. And it may be us making a suggestion and saying, what do you think? Or it may be one of them coming to us with something and say, hey, I was thinking about this, have y'all looked into this? And so we, that was just one example of different ways. We always do a program, and then we always have a tabletop. And that's the one that we really enjoy because we do have administrators and teachers and counselors and community members, parents. We have board members, Sue and Jeff are on that committee. And then we also have local law enforcement and fire department and first responders there as well. So it's a chance for us to walk through different scenarios. We've done a fire scenario, we've done a weather, fire alarm goes off during inclement weather. I mean, that's a pretty tricky one, especially when you get elementary kids. And if you don't have an adjoining campus, so we've done evacuation and reunification, and those are just some interesting things that we've been able to do. We've got some cool ones coming up to later this spring. And then what we encourage them to do is take those tabletops back, and when their district or when their campus safety teams meet, or they meet and with the faculty, is go through those same scenarios on your campus with your staff, and how would you respond to those as well. So we hope there's a trickle-down effect, that the things we're doing at our district campus committee is trickling down to our campus safety committees, and then go filtering down to the teachers and then down to the students. And one of the things that when we talk about drilling is that the psychological component of this and the psychological safety of the students is making sure our staff is, when we do a drill, especially the ones that are a lockdown, the ones that are a little more traumatic and a little scarier, is making sure that the follow-up on that is, we're not doing this to scare you, we're doing this so we'll be prepared in the event that something actually, we ever have to do it for real, and we ever do have an emergency. And that's the scary part of it, but that's one of the things we think we can do to kind of help with that.
Along with that, what we do is we encourage each of the campuses to have a few minutes after a drill to speak with their students in their classrooms. And, from the elementary side, that would, look like, why do we do this, and so on. And then give them a chance to go ahead and maybe talk about how they feel or how they felt about that, especially the lockdowns. Because the kids, even though it's a drill, sometimes they register that it's a real one. So that's that component, making sure that the kids feel safe and they understand what's going on, and we keep them in a good place. Not only that, but the additional plus to that was that it allows the teachers to vocalize their concerns, what they felt and how they feel that maybe things should have gone, or even, just a chance to vent sometimes.
Are elementary kids told, if there's a lockdown, why there would be a lockdown, or do they just know it's a lockdown?
That's part of all the training at first, is especially through the response protocol, the standard response protocol. So we don't do any of that before, we've had a chance to be able to talk about that on those campuses, all of them. This is what we do. And then, throughout the year, that information is also available. We encourage the parents to talk to their kids about the drills. And then, again, we follow up after the drill, with that chance for these kids to have a few minutes to talk about it. So, we're always looking for a better way to do that, but it looks like that's pretty much the standardized practice, and we think we're going a little bit above that, which we're okay with, as long as we're talking to the kids about it.
And one thing about the response protocols, they're posted everywhere. They're in all the classrooms, they're in all the buildings, and it's, we're hoping that not only the reinforcement of when we drill, but we're hoping just maybe when they're walking around, they see the sign, maybe they're glancing at them and being familiar with them and reading them and looking at them. So it's become almost universal now, that's kind of the response that not only schools are using, but a lot of businesses and other groups are using those responses as well. So threat assessment, I mentioned earlier, I thought threat assessment was one of the most important components of this legislation. And threat assessment, by definition, it's a structured group process used to evaluate the risk posed by a student or another person, typically as a response to an actual or perceived threat or concerning behavior. And the primary purpose of a threat assessment is to prevent targeted violence. We just finished, like I said, 3 days, 3 different sessions. It was 1 session per each group, but 3 sessions of threat assessment training. And the biggest thing that our instructor tried to get across to everyone is that threat assessment is not to assess punitive consequences for actions. It's to prevent those actions from occurring and get the kids the in a situation where they can get the interventions they need to prevent it from happening. And I think that's the mindset that we need to look into. And sometimes, if the perceived or real threat has gone to a certain point, there are gonna be consequences because of what our code of conduct and our handbook and state law says we have to do. Sometimes, it's gonna be that we're gonna get that kid the support they need where it doesn't manifest into more serious behaviors. I guess would be the best way to say it. So we do have a district threat assessment oversight team. We do have campus threat assessment teams. The training has to be provided either by the Texas School Service Center or ESC, the Education Service Center, or another accredited trainer of threat assessment. So you could bring in any of the other groups that sometimes they contract out. We went with Education Service Center as our trainer, and I'll tell you exactly why. We brought them to us so we could train a volume of people at once. If you send people through the Texas School Safety Center training, you could only send 5 at a time. So for us to train 120 people, it would have taken us a lot of trainings and a lot of time to get that many people trained. So we felt like bringing a group here and doing the training was in our best interest. We had over 115 counselors, administrators, law enforcement representatives there. All of our SROs got trained along with our teachers. We thought that it was important. If this is the process we're gonna use, we want it, and we have to involve law enforcement anytime we do a threat assessment, it was important that they were trained the same way we were trained and know kind of what the format that we're gonna use. We're implementing processes now for how the teams will look at the campus level and also how information will be processed. So you get these situations. One of the things that putting the pieces together is, let's just say that there's a situation when a student's a 5th grader or 6th grader and it requires some interventions and it requires a safety plan or a threat assessment and nothing else, everything goes smoothly and nothing else happens until that kid's a sophomore in high school, is to make sure that information kind of goes with them so that you kind of know where that student may be coming from if those things come up again. So we're trying to put all those processes in place, and we worked with our trainer. We actually went to lunch with her a couple of days and kind of talked through all those things, and because those are the one things that doesn't mandate. It says you have to have a threat assessment team. Here's why. Here's what you have to do. You have to be trained. But it doesn't say how you implement it once all that's done. So those are the things that we're kind of working through. And then each threat assessment is required to have coordination and support from law enforcement. And then the different components of the threat assessment is you'll have input from administration, counseling, safety, law enforcement, special education, if that student's involved in those, or any kind of special population programs, classroom management, and mental health. So those are all those are all the different groups that are at the table when you perform a threat assessment. And that's like I said earlier, that's what each district is having to kind of define and figure out what that looks like for them. And we've done several, we've had the opportunity to do several threat assessments this year, and I think for the most part, we have been able to get some help to some of our students. We've been able to get law enforcement involved and maybe had some situations off before they became more serious. And I think our age groups have gone all the way up from 3rd grade up to our high school kids this year that we've had a concern, someone's brought a concern forward, or in some cases the student brought the concern forward and said, here's what's going on, I'm not sure how to deal with this. And so we may convene the team to try to help them through that process as well.
And it's interesting in working through those processes, you think of the victim, but a lot of times the perpetrator has their own issues and you have to work on the mental health of that individual and protect them and take care of them too. It's been interesting to watch the process work, that it really is a kinder, gentler nation. It takes care of both parties.
And so our next step, like I say, our next step is to make sure that at the campus level, and I think with our elementaries, they're not going to have as many, so they're going to have to do some more tabletop and just some basically some practice threat assessments just to kind of stay on their game and go through the process, so that if you only have one every couple of years or so, they have to make sure that they keep their skills. And then that training is they just says you have to be trained. They don't say how often, how much. So our anticipation is that we will make this an annual training, just like we do our other trainings. And the other training that we're looking into, and this one is a little bit harder than threat assessment, and that is the mental health first aid, which is, I think, a really good program. A mental health first aid, it's basically it's an 8-hour course that teaches someone how to, that teaches someone who's developing a mental health problem or experiencing mental health crisis. The training helps our employees identify, understand, and respond to the signs of addiction and mental illness. And that, we're gonna start with our nurses and counselors. And the challenge with mental health first aid is you can only train 30 at a time. The class sizes are limited. And so we're gonna start with a few focus groups, see how it goes, and then we're gonna try to reach that program out to as big a portion of our population as we can. Just doing 30 at a time and training 1,800 employees would take a really long time to get everyone trained. But we're gonna start with groups that a child in distress would most likely go to and make sure they have that training first. They're gonna go talk to their counselor, they're gonna go talk to their nurse, they may go talk to the SRO, they may go talk to a security guard, at the high school. They form really close relationships with a lot of those guys. And then we're gonna branch out from there and see how it goes. But those are recommended in the legislation. There's not a requirement like there is for threat assessment that you have to have that training, but we're kind of looking into that and getting certain groups trained in that capacity as
Who's
well.
gonna do the training? The service center again, or?
On the mental health first aid, no, that's coming through that's coming through Central Texas. I don't know if she used the local authority on that. That one's coming through. I know Service Center does it, but there's also the local health authority. The mental health authority does it as well. So that's actually who, the last time I saw a speaker on it, it was from one of the local mental health authority services, but I know Region 12 does it as well. So I'm not certain the name of
I'm just
what vendor
curious.
we're using, so I'll find out. Tell you.
Okay.
So that's kind of a briefing, that, there's a lot of moving parts to this, and
Mike, I mean, you've given us a lot of information, well, you've got a lot on your plate.
He does a great job.
From a policy perspective, is there anything that we have in our policies in the district-wide that have impeded your ability to do what you're doing?
no.
Or is there something that we need to look at that would make things better?
Nothing really that's come up. I mean, it's really all about training, I think.
Right.
But nothing I haven't found anything that's impeding any of this. It's just a matter of the areas where we know what to do, we're getting plans in place. The areas where we're not sure, we're reaching out to resources and we're waiting on some guidance from the state on how to get it implemented. So I think their goal is full implementation by next August.
Sounds like you guys are ahead of the pack on this SB, this Senate bill.
We're
Stop
open.
the Bleed, it was interesting, because I have a family member that works for their school district, they hustled to get the Stop the Bleed training as soon as they came back from Christmas, whereas we had it when I came in August, so it's been kind of a,
Yeah, our guys have already had 2 years.
Yeah,
The employees that have been here have
protocol
already had
here
it twice.
other places it is not, so, a lot of the districts are doing their training now, we've had it for a couple of years.
And a lot of that's on, I'm new to the game. It was, the district kind of having the foresight to head that direction and, bringing Pete and Doug on, and they do a fantastic job. I mean, when you have guys with the experiences they've had and the time to really look into this stuff and make sure we've got good practices in place, I think is essential. They've done a fantastic job with it, and, we're all working through this stuff together, but the main thing we want to do is and the district and the board, y'all committed resources to protect kids. I mean, and to keep kids safe. And when we've come and we've said, hey, we think this is important, we think this will help keep kids safe, without exception, I think the board's always come back and said, yeah, we need to do this. And I think that's a big piece of this thing is that I'm sure that we'll come with more things that we need to help keep our kids safe.
Y'all had a good time, because this had a large mental health component to it. And
What-
that's very different than when
Yeah.
it was implemented 20 years ago. There was no mental health in it
Absolutely.
whatsoever.
Safety first and foremost, right?
Yeah. I think if anything that, as far as the board's concerned, again, to, just kind of echo what Mike said, is that the support system here within this school district is really big. I've been an SRO in other school districts have had SROs and so on. And I think all school districts want to do, good things for the kids. Sometimes you have to be that group that takes that first step. And that's typically a hard one when you're talking about public schools and so on. But if anything, this has really enhanced our ability to do it where we are now. And if there is anything that the school board will need to do, it'll probably come when, the school safety center and all those other pieces are finalized and they put it out to us.
Well, and compliments to the state too. I mean, they've made school safety a priority, our legislators have. And, making it a priority is one thing, but funding it's another thing. And, we received a school safety allotment, which is used as part of your safety and security budget, but also these TEA grants were huge. And we got round one, and the districts who applied for round one are gonna get a second installment once they divvy up the money from the schools that didn't apply for it. So we fully anticipate to get a second component to this grant at some point throughout the spring and summer, once all the dust settles. So, the state has put kind of their money where their mouth is a little bit with safety, and has helped fund some of these initiatives and some of these goals.
Well, you mentioned earlier that the Senate bill should be the floor, but we're going beyond that.
Mhm.
And I think we should always strive to go beyond that when it comes to the safety of these kids.
And our staff.
Yeah, and staff, that's
Yeah.
right.
Anything else, boss?
I don't think so. Rosie?
I just have a question. At the school board training this summer, there was a thing on Senate Bill 11. Sorry. There was a Senate Bill 11 training, and then it was a speaker from the University of Texas.
Mhm.
And she talked about how she got all these grants to implement the mental health component of Senate Bill 11 into the school districts, and how to better identify these at-risk kids. And there was actually data on, they had worked with some of these children, and it's kind of hard to present a lot of data at a school board meeting, right? So I did not follow up on that yet, but have we reached out to that particular program? Have we reached out to the?
Usually we
I
use
haven't.
Texas State University because that's the Texas School Safety Center, so I'm
Mhm.
not sure about UT, but
Mhm.
Texas
It was a
State
person,
is
she said like the first year that she did it, she reached out to the state and said, I would like $5 million to get this implemented in some of the schools in Austin,
Mhm.
right? And again, they did have, she came from UT, but she said, I would like $5 million to get this implemented. They gave her $5 million. They came back next year and she said, okay, I want $9 million. So she had $14 million within 2 years, which is kind of weird from a mental health perspective. I know that happens in other places, but that doesn't typically happen in mental health. So, I'll bring my notes, but anyway, I thought it was interesting because it hits the angle of how do you hit the at-risk kids accurately? How do you identify them, and how do you have services within the schools?
So I'd be very interested to hear more about that.
Chris, anything? I did have a question. You mentioned the cybersecurity, the training on sexual abuse and then human trafficking for the school board members. When is that gonna happen, and when do we need to have that done? Is it gonna
Probably
be during
during-
the summer?
Probably during your Summer Leadership Institute,
Okay.
SLI, they'll probably get a blast of that. And they'll probably package that, we ought to get all that at one point in time.
It's not anything that will happen here. It'll happen.
I don't think so, I would guess through SLI.
Anything else, Pete?
No, sir.
Mike?
Thank y'all.
Okay.
Thank
All
you.
right. Then I guess we're
We
adjourned.
went light on you tonight.
That's
You
good.
had some